Is this vitamin too powerful for CKD patients? This patient literally doubled his kidney function back to 66 almost overnight. He escaped CKD using a remedy your doctor will never prescribe. Catherine here, I'm a doctor of natural medicine. Most CKD patients are relying every day on a pill-only approach. You see your doctor and all the help you get is more pills. Question: what happens when a CKD patient stops relying on a pills-only approach and finally uses a natural, comprehensive protocol to fight kidney disease? You know, vitamins, supplements, dietary changes. Well, this is exactly what we are going to see today. I will show you 5 documented natural protocols that produce massive results in CKD patients. Guys, this is not stuff your doctor will ever prescribe, right? And yet, this 65-year-old man more than doubled his kidney function. As you can see, his GFR jumped from 32 to 66, which means, medically speaking, he no longer has CKD. Please let that sink in for a second. And that's not all. His HbA1c also plummeted straight back to normal shortly after starting this protocol. And now the part that's shocking the world of nephrology. The doctor who helped this patient improve, she wasn't a kidney doctor or a nephrologist. No, she was a naturopath. So now the question is, are kidney doctors doing enough for their CKD patients, or are they just managing your decline with handfuls of pills? Let me know what you think in the comments right now. Do you feel like your doctor is actively fighting for your kidneys, or do you think they could do more? Because today, I'm going to show you 5 treatments that doctors never prescribe, but that hold the power to change everything. Starting with our number 5 for today, this is the exact blueprint that helped a 65-year-old man completely escape kidney disease. But the most fascinating part of this medical paper isn't just the unusual treatments they used, it is why he used them. Like I was saying, this patient was so incredibly fed up with his doctor just handing him another pill bottle, he took matters into his own hands and walked straight into the office of a naturopath. So let's take a look under the hood at the specific approach this doctor used. Because as naturopaths, we are trained to look at the human body as a whole ecosystem. We don't just put a band-aid. We attack the disease from every possible angle. That means targeted exercise, a specific diet, and cognitive behavioral therapy for insomnia. Wait, treating sleep to save the kidneys? Most people think their sleep schedule has absolutely nothing to do with their renal function, alright? Dead wrong! When you don't sleep, your insulin sensitivity crashes and your hunger hormones skyrocket. If you have diabetes, that is a recipe for disaster. Even worse, hard science now links short sleep duration directly to a rapid, violent decline in kidney function. So I believe you are starting to understand why a pill-only approach doesn't always help. Addressing these hidden root causes, the exact things traditional doctors ignore, is why his results look like this. The intervention didn't stop there. So let's also talk about the supplements he was prescribed. Something very peculiar here is a combination of glutamine and curcumin. Why? For digestive healing. Because you see, gut health is a seriously underestimated issue in CKD. Many people don't know this, but the toxins that are assaulting your kidneys every day are generated in your gut. Deadly uremic toxins like TMAO, p-cresyl sulfate, and indoxyl sulfate are brewed right in your digestive tract when you break down protein. And if you also have a leaky, inflamed gut, those toxins spill straight into your bloodstream and carpet bomb your kidneys. And this is where glutamine and curcumin can help. Glutamine is known to help strengthen the gut wall, reducing gut leakage. Curcumin, on the other hand, has powerful anti-inflammatory properties that help make gut healing possible. So in short, receiving an integrated treatment that includes sleep counseling and a combination of glutamine and curcumin for gut health made a huge difference for this patient. Because in this case, just receiving pills to manage the decline of his kidney function wasn't enough. So let's move on. Number 4, let's talk about the massive blind spot in standard kidney care. There is a hidden complication that destroys kidneys fast. And here's the thing. I've seen so many nephrologists completely mismanaging it. It keeps me up at night. I'm talking about anemia. For some reason, anemia seems to confuse so many doctors. Let me explain. Anemia is a common blood disorder in which you don't have enough red blood cells. Red blood cells carry oxygen around the body, alright? Which means that if you don't have enough red blood cells, you are going to feel very tired most of the time. So how to tell if you have anemia? Well, if I need a rest has become your full-time job description, make sure your hemoglobin is not too low, alright? But don't wait until you are too tired to even complain about being tired. Listen guys, anemia doesn't just cause fatigue, it also causes fast kidney damage. This is why you really need your doctor on their absolute A game when dealing with this. And here's the thing, most doctors aren't. Let me hit you with a terrifying statistic. Up to 87% of certain CKD groups are walking around with anemia right now. But up to 78% of them, they are getting absolutely zero treatment. What this means is that a huge number of CKD patients are left entirely undefended against a known kidney killer complication. Are you starting to see why the number of patients starting dialysis surges every single year? Now guys, there is a reason why so many standard doctors use a dangerous wait-and-see approach. And no, it is not because anemia magically fixes itself. It almost never does. It is because anemia can be caused by the failing kidneys shutting down erythropoietin production. Or it can be triggered by a simple, completely reversible nutritional deficiency. Yeah, very often it is just a lack of iron or B12. But here is where the confusion kicks in. Standard doctors see CKD and anemia on your medical chart, and in some cases they immediately assume your kidneys are to blame for the anemia, while in reality it is very often caused by a highly treatable nutritional gap. The terrifying result, a massive percentage of patients are shoved straight into the dialysis chair because of a completely treatable vitamin deficiency. So what is the game plan if you refuse to become part of this statistic? First of all, you aggressively plug those nutritional gaps. You cannot skip your daily renal multivitamin. Rena Best can help. This is my very own formulation, and when I created it, one of my primary goals was handing you a daily shield to prevent this exact complication. Rena Best is loaded with a precise, kidney-safe dose of iron to crush your risk of deficiency. We paired it with just enough vitamin C so your body absorbs that iron like a biological sponge. It is a massive 1-2 punch against anemia. Add in the exact safe amounts of active vitamin B12 and folate, and you are actively defending against low hemoglobin. Now, here's the thing. Rena Best helps, but it won't magically replace EPO if your kidneys stop making it. So, you also need some help from your doctor here, especially if CKD is advanced. In short, never let anemia go untreated. A renal multivitamin like Rena Best can help, but for some patients, medications are also needed. Make sure your doctor isn't forgetting about this devastating complication. Okay, time to talk about our number 3 for today. This is a better natural alternative to sodium bicarbonate. Now guys, if we take a closer look at case report of this 65-year-old who was able to double his kidney function, we can notice something interesting. He was prescribed sodium bicarbonate by his nephrologist, but then the naturopath who helped him improve decided to stop the sodium bicarbonate. So question, is sodium bicarbonate good or bad for your kidneys? Because here's the thing, few treatments divide the kidney community as dramatically as sodium bicarbonate. Depending on who you listen to, it is either a life-saving kidney treatment or a dangerous substance that could skyrocket your blood pressure. Who is right? Well, both sides are right actually. You see, there is a reason why this patient was firstly prescribed sodium bicarbonate by his nephrologist, and that's because his serum bicarbonate was too low, as we can see. When that happens, we have a serious problem. It's called metabolic acidosis, and it causes several serious health problems. Not just faster kidney function decline, but bone and muscle loss as well. And you see, most nephrologists aren't particularly happy when they see their patients slowly become walking skeletons, alright? So they will prescribe sodium bicarbonate, hopefully before that happens. But just like you probably heard a million times on the internet, sodium bicarbonate contains a small amount of sodium, which could make blood pressure control harder and damage your kidneys. This is why when we take a holistic approach to the treatment of CKD, sodium bicarbonate is not the most attractive solution anymore, alright? Because it treats the symptom, not the cause of metabolic acidosis. So, how do we attack what's causing the problem? Well, the very first step to stop metabolic acidosis is always a plant-based diet. Because you see, the acid that's slowly destroying your kidneys and your muscles is created by the metabolism of protein. When we remove fish, meat, dairy, and wild junk food from the diet, we can see amazing results also in terms of serum bicarbonate levels. I have many patients who were able to get their serum bicarbonate back to normal and to stop losing muscle mass just by swapping meat with kale. This is strongly supported by science, by the way. Now, something else I usually recommend to reduce the need for sodium bicarbonate is lemon juice. Many people don't know this, but lemon juice is incredibly alkaline. Again, says science. In fact, the citric acid that makes lemon taste acidic is turned into citrate in the body. And do you know what your body does with this citrate? Bicarbonate, which is the same thing as sodium bicarbonate but without the sodium part. And yeah, this is exactly how I help my patients improve. So in short, just like anemia, metabolic acidosis is a complication that requires a holistic approach. Diet, remedies like lemon juice, and if needed, sodium bicarbonate. Never skip any of these steps if you don't want to lose the battle for your kidney health. Okay, now let's move on to our number 2 for today. Let's talk about how to reduce your dependency on blood pressure medications. Now, as we can see from the case report we are examining today, this patient was taking so many pills and with side effects so severe, he was literally afraid for his own life. Because you see, even the most commonly prescribed medications millions of CKD patients take every day may have serious side effects. For example, blood pressure medications like ACE inhibitors and ARBs, lisinopril, ramppril, losartan, they help with blood pressure and proteinuria, and they do work, but they have side effects most patients are not warned about. Hyperkalemia or high serum potassium. I know, shocking. Another class of BP medications that cause side effects is calcium channel blockers, alright? These are very common as well. I'm talking amlodipine or Norvasc. They have one particularly nasty side effect. They can cause swelling. Now, when some patients face the side effects of these medications, they stop taking them. The result, blood pressure skyrockets, causing kidney damage. Please don't do that. Instead, learn from the example of this 66-year-old who was able to get off kidney disease with a natural approach. What he was recommended to reduce his dependence on these medications was a powerful integrated approach. First of all, he reduced his sodium intake. Less sodium equals less blood pressure. No need for a high dose of losartan and Norvasc every day if your blood pressure is already low, alright? Something else everyone should do to avoid needing lots of BP meds is exercising. And I know, guys, starting to exercise is never easy, but do you really prefer spending the rest of your life being afraid of bananas? And let's talk about Farxiga. This is something else many patients are worried about because it's known to cause urinary tract infections. But here's the thing, Farxiga is one of the most powerful prescriptions we have when it comes to lowering proteinuria. Yeah, it's a literal kidney saver. So my advice, if you have been prescribed Farxiga, take it. There are natural ways to deal with UTIs. I often recommend cranberry extract as it's a very powerful way to prevent and help treating infections, even those caused by Farxiga. Now, another medication class you should know about are statins. Atorvastatin, rovastatin, simvastatin. These save your heart and kidneys from cholesterol, alright? What many patients don't know about is the myalgia or muscle pain they cause. Luckily enough, there's a simple solution that doesn't involve letting your cholesterol go out of control. Always supplement CoQ10 when taking a statin, alright? And you can get CoQ10 from Rinabest, so you don't even need to add more pills to your regimen. But remember, skipping your medications is never the answer. Finding natural ways to reduce your need for medications and to avoid dialysis is the answer. Okay guys, time to talk about a vitamin-like molecule so powerful your doctor is too scared to prescribe. That's our number 1 for today. And here's the thing. This vitamin-like molecule, it was actually used to prove that dialysis is not always the answer. Let's take a look. In this paper, researchers gathered together 97 CKD patients with very little residual kidney function and that are either in or right about to start dialysis. Their goal, proving that some doctors are still starting their patients on dialysis even if they don't need it. But how do you even prove something like that? Simple. You give half these stage 5 CKD patients a placebo and the other half a vitamin-like molecule to kickstart their kidneys back to life. Okay, now the incredible part. They had 48 patients in the treatment group and 21 of them were doing dialysis. But after 12 weeks of the treatment, only 12 patients were still doing dialysis. 9 patients didn't need dialysis anymore, which is incredible. And by the way, 81% of the patients in the treatment group had significant improvements in their creatinine levels, even if they were not doing dialysis. So question, what vitamin-like molecule were they using in this paper? It's CoQ10. CoQ10 is very similar to a vitamin in the sense that when a deficiency is present, we can observe serious symptoms like loss of kidney function. And while the body can produce some CoQ10, having a disease like diabetes or CKD can destroy your reserves of this molecule way faster than your body makes them. And this is why I always recommend all my patients to supplement CoQ10. And if you want to see more science-backed treatment to stop dialysis, my video up here is for you, and this is all for today. Thank you for watching. God bless you all. Bye!